Okay, well, hello everyone. My name is Dr. Aminola Dada, for those who don't know me. Welcome to the Healthy Joints, Healthy Lifestyle Show. And so I have a treat for you. But before that, I'm going to tell you a little bit about myself. I'm a rheumatologist in the greater Seattle area. I help people with joint pain and autoimmune diseases become pain-free and get their immune system back on track. So when we're talking about becoming pain-free, this is where Dr. Maria Colon is going to really help us out. I have just started thinking. I haven't even gotten into yoga. I'm a little afraid of it. And so this couldn't be a better time personally in my life. And so I'm going to ask questions on behalf of everybody. But Dr. Maria, tell us there's more to you than, you are an internal, you're a primary care doctor, you are certified, you have so many certifications, you're also doing there's just so much to you. I'm going to let you introduce yourself, and I can't wait to get into it.
Yes, thank you. So my name is Dr. Maria. I am a physician in the state of Texas. I have worked mostly with the Hispanic Latino community here in the United States, and I have been in practice for 10 years. During my time in practice, I have also become a diplomat of the American College of Lifestyle Medicine because I am really passionate about helping my patients live truly healthier lives. I'm also a fellow of the Academy of Integrative Medicine. I am finishing that fellowship in October of this year,
Wow.
graduating soon.
Congratulations.
Yes, and during medical school, I was also a group fitness instructor during college, right? And when I started in medical school, by my second year, I realized okay, I cannot continue to be a full-time medical student and work. So I, stopped. And then after I started in medicine again, that I started to realize there's something a little bit wrong about the way that we practice and we try to help patients. Not only did I did my certification, right, or my board exam of lifestyle medicine, but then I went back and got trained only specifically in yoga. And I didn't go into all of the fitness. One, because of, the time, I was also a doctor, but also because I find that yoga, especially for me, it's the one form of movement that makes me become so much aware of my body. And I really have, it's like running. I have like this, so much good emotions, and it's so much good for my mental health. Then that's why I did it. I am the owner and founder of Salud Revisited. And what I do in Salud Revisited is really that I help my patients heal in their mind, body, and spirit. And I am specifically passionate about reducing the use of medication de-escalation. That's my passion. So that's a little bit about me.
Wow, that's amazing. You are more multifaceted and multi-talented, and I think that helps bring kind of the holistic view. So, and I think that's the way medicine is. That's the way patients get to, we're trying to find ways to be more preventive and also be kind of more aware of what our body can do to help us and how to harness that. So I am very, very, very interested in the yoga aspect of your and so a little bit about me. So I think after med school, I think actually at somewhere in the middle of med school, I started kind of exercising. So I think I went from a jogger to a runner, to more exercise weights. And then I think in the last decade, it's been like some cardio on the Stairmaster and then lifting weights. And I never, I walk by the yoga people and I'm like, I'm gonna lift weights, So and so I never really fully understood. I'm a doctor, I know I should understand, but I don't think I really fully did. And now I'm just kind of warming up to the idea that I definitely have to. And I'm a little concerned that, all this strength training, I'm pretty strong, that's great, but what's happening to my ligaments and tendons? And so really want to kind of ask you kind of what your thoughts are, what the benefits of yoga is, and when should we start?
Yeah, so let's talk about the benefits first. So first of all, I think that yoga helps in this disconnection that a lot of the times we have in the Western society from what's going on in our minds to what's going on in our bodies, right? So it helps in that union or communication. And I think that this is really important because how many times do we ignore the signals that our body sends and we just push through? Also, a lot of the times it can help you become aware of your breath. And you would be surprised how many times people tell me, oh my God, yeah, I didn't realize that, but I was just like holding my breath, right? I don't take this full breath, right? And it's not that all the time we breathe like that, but the breath is super important because with the breath, we can activate the vagal nerve, the parasympathetic response. So therefore, it also helps us from being up here, which is very easy in our society and our culture to be down here. So it helps with your mental health, it helps with the awareness of your body. And it's specifically for people that have connective joint diseases, right? Not only arthritis, but also things. So I like to think about like the inflammatory and then the genetic types of conditions where they also have hypermobility in their joints. So it's a way, one, where you can increase the strength of your muscles. And we know that when we increase the strength of our muscle without having to lift the weight of the repetition, because this is what we call concentric, type of strength, where, for example, you're holding your chair pose, like you're in a squat, you're holding it, you don't have no weights, but those quad muscles are working and are growing. And we know that in order to prevent injuries, we do need strong muscles. And at the same time, as we get older, all of us, we lose our flexibility. Think about a baby. The baby can put like the leg up here, right? And as we grow older, we can not do that. And having flexibility and proprioception, whereas I am aware where my body is in space, again, helps prevent injuries, right? So you're talking about helping prevent injuries. It helps manage pain. It helps with mental health. And one of the things that we forget is when people live in pain, it's not only about reducing the pain, but it's also improving their mental well-being and their perception and their relationship with their bodies. Yeah. So we can do all of that through yoga.
Yeah. There is so much to that. And I'm going to just go back just for to talk about that proprioception, because that also speaks to me in my world. I explain proprioception to my patients as when you close your eyes and you know where your foot is, right? You close your eyes, the ability to know where your foot is, where you're positioned when you're not actively looking at it. And so a proprioception is important in my world too, because I tell them, hey, when you have, to prevent falls, to prevent fractures, right, you need to strengthen and tone your tendons and ligaments. And yoga is something that I've started to encourage my patients to do. Typically, or just physical therapy, strengthening, balance, coordination. But I think yoga sounds like it's going to be huge in terms of being an additive component. And a lot of patients are reluctant to go to the gym. If you're not a gym rat or you haven't been going, it's a little intimidating. But I think going to a yoga studio or even doing things online or doing things with an instructor, what would you advise, right? Well, do you think I just put on a video and try to watch it? What do we do? How do we start?
Yes, so really good question. How do you start? So if you have never done a yoga class, I would actually recommend that you start by looking for either a studio. It doesn't have to be what we call a boutique studio, right? A boutique studio will be a little bit, it will cost you a little bit more, but you want to look for a studio, and some studios offer specifically beginners class. Okay, so if you are in a studio that offers a beginner's class, that's really good. Another thing to consider is starting with a class that we call restorative. Okay, and in a restorative class, this is not the class that perhaps you might say I'm going to use to lose weight, right? Or to make your muscles really strong or your heartbeat going fast. But it will start to teach your body the forms with what we call the props in a safe way. So the props is using your bolster, your yoga mats, your yoga straps, so that then your body becomes a little bit more used to this is what we're doing. And then you can build it up. There's also studios that offer private classes. And I think that if you are a person that perhaps you are intimidated in being in a room with other people, which is normal, it can happen, or you are in a stage of life where maybe your medical conditions are really like up here, right? You have a lot of inflammation, perhaps your body habitus, your body form is a little bit more on the larger size, and it's not that you cannot do yoga, right? But there are certain precautions. Or you're coming out of a knee surgery, hip replacement surgery, right? Those big things, doing a private, it's really good because then we can really, really work with you and with your needs. I think that if you have had some experience and exposure, yes, you can get some really good videos, right? And I can send you, there's like Yoga with Adrienne. It's very, very popular. That's the way that I started. I started to practice yoga because I have a medical condition in my back. And when I was in my teenagers, I literally would go to bed crying. I had done physical therapy, you name it, right? And my parents were off for surgery. And at that time, and in Puerto Rico, the doctors were like, this is 50-50. And my dad was like, well, we're not going to do it.
50-50.
Right? So I started doing yoga videos with Rodney Yee. He now has a little bit of white hair from Gaia, right? Yoga Gaia. And I think that if you have already some level of fitness and understanding of your body, it is okay if you do it at home with videos. But if you're completely new, you have not been moving, then you want to do it with somebody.
Yeah. Well, okay. So that's actually really helpful because it makes sense. If you have no clue like me, and maybe I've done 1 or 2 classes on the beach a long time ago, you basically have no clue. Sounds like we need to kind of go to a class, get an instructor, make sure we know what we're doing and make sure we're doing the right thing. And then as you get more familiar with it, then it totally makes sense to try to do it on your own. Or if you have certain health conditions, then maybe you need some more guidance. So that's very helpful. Okay, good. And so tell me how you kind of, what role you play kind of in helping patients regarding this.
So I think that I play 2 roles, even though they're different. So one is I do teach yoga, right? That's part of what I do. And in my yoga classes, sometimes people they're the yoga junkie, right? And they want to go for like the sweat and, feel it, the power. But again, I help people that go to one of my class to connect with their body, to calm down their nervous system. And then I am really a lot about let's do it correctly. We don't have to do, 15 poses in a class, because sometimes you think that that's a better workout. If we get to do 5 and we do them with the right form, that is so much better. So that is one. And then I think that my other role in this is as a physician, I might have patients that come to me and ask me, what should I do? One, I always advise, to be physically active. And then a lot of the times they ask me, so what should I do? Right? And it's this interplay into what do you like to do and what is, affordable, accessible, that sort of thing. And you might know that in some like gyms or studio, if you have certain medical conditions, they would also ask kind of like for what we call a clearance, like for you to have a surgery, which is basically this document, you take it to your doctor and your doctor is saying that, yes, that you can participate in certain physical activities. So I do also that. And then also And one of the things that I always tell some of my patients, if they're older, if they have certain medical conditions, I always tell them about moving in the water. And
Yeah.
people are like, oh, right. And I think that there is a population that benefits a lot for taking their body inside the water and then moving in there, right?
Yeah.
Not only can the temperature be a little bit warmer, it helps with
Yeah.
inflammation, but then it takes
Definitely.
all of that shock from all of
Yeah.
those joints and it
Yeah.
protects your
Yeah.
body.
Yeah. Yeah. So totally I agree. We tend to send people, especially people dealing with fibromyalgia, we tend to encourage like water aerobics therapy. And so just kind of minimizing, just kind of reducing the stress on their joints and reducing the risk that it kind of causes a flare of the condition. So it just reduces the impact. So that's very helpful information. So that's helpful to kind of know how a physician kind of fits into. So it almost feels like if you have a medical condition and you're kind of concerned about, starting yoga, then probably definitely want to be with someone. It couldn't be any better having a combination of someone who's also a physician and also can guide you into, your after post-op or your pre-op, and these are the exercises they're going to allow you to do, and having some guidance even out there in the world, because sometimes the doctor just writes, yeah, you can do 1, 2, 3, 4, 5 things, and you're like, I don't know how to interpret that in my real life. Yeah. So I think that's really valuable. I think they're lucky to have you. I wish you were around here in Seattle. Yes, I think they're lucky to have you out there in Houston. Wow.
Yes.
So tell me about a patient, if you can think about a patient who kind of worked with you and had a good outcome. I think it really helps us to kind of put ourselves in that patient's shoes and kind of see what it looks like.
Yeah. So that I can think of, I'm trying to think of specifically a patient that maybe had like a rheumatological condition, but none of are coming to my mind.
Any is fine. It doesn't have to be rheumatological. Yeah.
Yes. So, but definitely I can tell you. So one, a patient that he was a reporter during COVID time. And by the time that he came to me, he was very aware that what his eyes had seen in the hospital during COVID had definitely impacted him, right? So, we started to explore, and I remember this patient. So one of the things that he did was, he showed me the article, which was out there. But then after the article, he had written a series of letters. And these letters were for him like therapy. And he shared those letters with me. And he was in this like, oh my God, should I publish these or not? Right? Kind of like, do I want to make this public? And then as we worked together, he actually realized that the job that he was in was actually exacerbating and worsening some of I don't want to say necessarily PTSD, right? But some of the experiences, right, that he had seeing that in the hospital through COVID. So I think that is a patient that was able to realize that. I also have patients, one specific patient, right, that he was having symptoms that was clearly diabetes. The US Mexican American population, that's very common. I gave him the news, and I remember he literally cried. He was crying. And you know how it is, it's not like we have an additional hour to spend with our patients when they start crying, unfortunately. And I remember I had a conversation with my office manager, who was the one who checked him out. And I told him, hey, this is something that I think his A1C was like 8 point something, which is not that bad. And I tell him this is something that we can work on to get there, right? And he started to come to, the visits. We started to not only give him medications, but really help him understand. And with the wife, the wife is the one that cooks and does the groceries. So I have to bring in the wife.
It's a group, yes. So it's a family.
Yes. But we work with in terms of especially the food. And then I remember when he came back for his follow-up in 6 months, he was so happy that
Good
his
for him.
number, the A1C was so
See?
much better. And of
Wow.
course, he was
Yeah.
not peeing all the time and feeling tired
Yeah.
all the
Yes.
time.
Yeah. Yeah. Wow. So again, so actually those are two very interesting, totally different situations, right? Being able to work with you, with the reporter who didn't even realize he had it's basically sounds like some form of post-traumatic stress, right? And being able to work with his doctor to try to figure out, what was causing some of the manifestations that he was experiencing, identifying, and then making an informed decision of, what to do next. And then the second person is someone who probably been, urinating all the time, which is a symptom of diabetes, right? But not really having a diagnosis, and getting the diagnosis and being panicked, right? Probably, all you have to do is what will happen to you when you have diabetes on Google, right? And that's enough to panic you. But kind of now being under the care of his doctor, you took the time, and that's really an additional step that you did, really taking the time to talk to the family, because a lot of it is the diet and the nutrition, right? Avoiding the high sweets, high carbs, and cutting down where he still feels full, because he didn't come in looking hungry. He did feel full, but just filling himself with food that was much more nutritious. And that was under your guidance, right? Otherwise, it's just you have the ability to take this pill. You kind of said, oh, definitely the pills have their place, and probably he may have needed that. But you also kind of looked at, the family situation, and really kind of got his wife on board. There's nothing better than having a wife on board. I'll tell you that. Because when she's on board, some things will not even be bought in the grocery store. So you'll never get to see it, right?
Yes.
So I think that was really amazing that you were able to, those are two totally different, situations. And then just because the patients were under your care, they really got these amazing outcomes.
Yes. Yes. And I think that, any type of, unfortunately, like medical condition that is like chronic, right? That it's not like your common cold.
Yeah.
If we can help like the family, right? Because a lot of it is, right? Again, the food, the physical activity, the going to bed, right? If you live with somebody that is very separated from that type of lifestyle, you're going to start to have friction.
Yeah.
So I think that that's important in the care that we provide.
Yeah, I totally agree with that. So on our Healthy Joints, Healthy Lifestyle show, we like to give our viewers wins. So can you give me and our viewers kind of 3 easy tips that we can implement right now to become healthier versions of ourselves?
Yeah, so I think that specifically for people that might have joint conditions and if they have inflammation, I would say if you can take away like your milk products, your eggs, and gluten, that would be a good place to start. Eat a little bit more of papaya and pineapple. That's really good. The other thing is sometimes journaling can help you identify maybe things that are triggering symptom or inflammation or pain. And it doesn't have to be half an hour. It can be 2 or 3 minutes to just become aware and then ask yourself, okay, so what can I do to help myself to maybe change that behavior or avoid it? And then, in the population that have joint medical conditions, whether it is RA or one of the other ones, they can live with pain like fibromyalgia. So, good oils for aromatherapy to use for pain management would be lavender, sesame, ginger, and bergamot. So either an oil or a candle, you can just light it up and just let that, put it in your environment, in your home. And we know that it will help you reduce your sensation of pain.
Yeah. Well, those are really helpful. I was talking to another colleague, I think about a month ago, and we were talking about the essential oils, and we kind of talked about lavender and sesame. So it's really interesting that you bring it up again. And so that's something that we've been starting to kind of talk to our patients about, at least give them the resources so that they can get that. But I think that the summary of the 3 tips that you gave me was also a little bit of just kind of being more in touch with your body. I feel like you get a little bit about that from journaling. And when you talked about yoga, you kind of mentioned that you just kind of increase awareness. We're all such on a run, we're just running. And so sometimes we're kind of losing touch with kind of what's important, right? So journaling gives you some time to reflect. I think when you actually take a minute to reflect, you pause, and information is power. Right? So thank you. So the first one was kind of talking about certain foods. The first one was talking about foods. The second one was talking about journaling. And the third one was kind of more thinking about the aromatherapy. I love lavender, so I'm just going to keep talking about lavender. But yes.
Absolutely. Absolutely. And those are simple things that you can start doing today. Right. And you don't even need to probably see your doctor. You can start doing those today.
You can start, because we always want to empower people. Everybody wants to know, what can I do for myself today? Good. So, I got my fun question. Yeah. So, what superpower do you wish you had, and why do you wish it?
Yeah. So I wish that I was kind of like Superwoman and I could like fly. Why do I wish that I could have it? Well, I hate driving.
You're a very practical woman, doctor.
So I feel that if I could fly, I wouldn't need to drive, and it would probably be faster.
That would take care of that. I love it.
Yes.
So, how can patients find you, right? So we're gonna put the links at the end of the show, but tell me how. Thank you so much for coming. I appreciate you. I think this was really fun. I'm actually motivated. I'm going to sign up this weekend to start my yoga. So really motivated. It's very helpful, and it sounds like it's going to help kind of with, I have strong muscles. You have strong muscles from working out and exercises, but what about the ligaments and the tendons? And as we get older, we're stiffer. Remember when we came out through the birth canal, we were like that. Now to be like, so
now we're breakable. Yeah,
now we're breakable, right? So that's my personal takeaway from it, and also kind of that it's going to help me to be more in touch with my body. And so how can patients find you? I think there's just so much more that you have to offer, and I think a lot of people will benefit from finding you and working with you.
Yeah, so they can find me on social media, Facebook and Instagram, as well as YouTube. My handle is Salud Revisited, and that is salud like in Spanish, health, right? And then you can also find me online with my website, so www.saludrevisited.com. And I see patients locally in Houston, but I'm also open virtually. So any patient in the state of Texas can actually benefit from my services.
Okay, perfect. Well, thank you everybody for listening, and thank you for watching the Healthy Joints, Healthy Lifestyle Show. Please subscribe to our channel, like this video, share it with anybody that you think would be benefit from it. And thank you so much, Dr. Cullen. Loved your talk. We'll talk to you soon.
Thank you. Okay, bye-bye.
Bye-bye.